Hi everybody. We are going to today talk about Chapter 9 in your textbook. And Chapter 9 just gets into fostering those inclusive experiences. So we're going to look at different populations. For example, pregnancy is a big one, older adults, youth, people who have different chronic conditions like back pain, so this chapter kind of talks about ways that we can include, these types of folks in our workouts. So just kind of before we get started, ask yourself, have you ever tried to exercise while you were ill or while you were injured? What was your experience like? Because a lot of people want to exercise even though they have back pain, but how can they safely exercise, right? What are some strategies that we can do to work around, some of these injuries? So as a group fitness instructor, we have to be thinking about all of that sort of stuff. So before we get started with any of our classes, especially if you are an independent contractor, and you are, have your own business and you're teaching your own classes, we have to think about screening our participants prior to them beginning any of our classes. So these are just some of the forms that we want to make sure that we have on file and we have documentation of for each of those participants. So these screening forms are health history documents that are typically collected at the initiation of the enrollment to a fitness facility or a defined group fitness program, along with the informed consent and a release of liability waiver. It's the responsibility of the facility or the business operator to determine if medical evaluation by a physician is warranted prior to the individual participating in physical activity based on the health-related information provided on his or her pre-participation forms. So furthermore, group fitness instructors must make participant privacy a priority. So all this information that we're gathering on each of these forms are personal health information. So it is protected by that HIPAA, Health Insurance Portability and Accountability Act. So we're gathering personal health information from these participants in our classes, so we have to keep that information private. But like I said, these are all forms that, especially as an independent contractor, if you're going to be, having participants begin, say, your boot camps or, your types of classes that you're going to be teaching, you definitely want to have these forms on file and have those participants fill out prior to them beginning your classes. And then you would deem if they need medical evaluation prior to starting your particular class or your program, then we will, you would refer them to their healthcare provider. Now, when we'll get into this a little more in the personal trainer class, because definitely in personal training, normally we're independent contractors, so we definitely want to have these forms in our arsenal. So we'll talk more about those in that particular class too. So here are some different health conditions that we might come across. So coronary heart disease is definitely the most common cause of death in those individuals that are 65 years of age or older. So it's that development of atherosclerosis in the coronary arteries. So that plaque begins to build up on the walls of those arteries, and therefore if it's left untreated, MI, myocardial infarction, which is a heart attack, or a stroke can occur, or even peripheral heart disease. So, that coronary heart disease is kind of that big umbrella where those arteries can become blocked, all right, with plaque. And that can not only occur in the heart, but it can occur in your brain, and it can also occur in the vessels in your extremities as well. So as far as the other cardiac condition we see, and that's hypertension, note that the guidelines have changed as far as hypertension goes. You can see on this slide that the former guidelines are a little bit different than the new American Heart Association guidelines. So due to these new guidelines, you can see that millions more Americans are going to be diagnosed with having elevated blood pressure. Okay, elevated blood pressure is having a systolic blood pressure of 120 to 129 and a diastolic of less than 80. So before we would say, hey, if your systolic is in the 120s and your diastolic is in the 80s, say it's 124 over 84. That's good. Well, now with these new guidelines, that would not be considered good anymore. Now it's considered elevated. And hypertension, stage 1, hypertension is now diagnosed as a systolic 130s and diastolic 80s. So that's now considered hypertension. So with these new guidelines in place, many more Americans are being diagnosed with high blood pressure. So that constant force from that high blood pressure definitely can damage the arteries and the organs. So that's why we want to make sure that we're trying to control that blood pressure. So as a group fitness instructor, we should keep, some of the general exercise guidelines in mind when we're instructing people who have known cardiovascular disease or have risk factors for cardiovascular disease. Like maybe they have high blood pressure. That's a risk factor for cardiovascular disease. So for these folks, we want to definitely emphasize the importance of self-monitoring their exercise intensity. They need to self-monitor. We don't know, if they're starting to feel lightheaded or they're overworking, they need to self-monitor and stop, or take the intensity down when they start to feel that, hey, they're overdoing it. Also, as an instructor, we should avoid abruptly changing body positions from lying down or even from seated to a standing position. So laying down to quickly getting up is not a good idea, or sitting and quickly standing up is not a good idea because that can elicit the orthostatic hypotension response, which is a rapid drop in blood pressure. Okay, this can cause dizziness in that individual. So definitely not good for people in these particular conditions. So gradually changing positions is recommended for these folks. Also, we want to avoid the Valsalva maneuver. That's when we hold our breath. Okay, holding your breath is going to increase intrathoracic pressure and therefore worsen the effects of high blood pressure. So these folks definitely do not want to be holding their breath at any point in time during any exercise. So we need to reinforce proper breathing techniques. And lastly, avoid isometric exercises. Isometrics also can elicit a greater response in blood pressure. So definitely we'll see a rise in blood pressure when we have isometric exercises. So remember, isometrics are where there's no visible joint movement. So for example, doing a wall squat or doing a plank, anything where you hold it for that extended period of time, that's considered isometrics. Okay, so those are things to think about with these particular conditions. Next area is the pulmonary. Okay, so you have people who have things like exercise-induced asthma, EIA, exercise-induced asthma. So either physical activity can induce the asthmatic response or exercise in general reduces the asthmatic response in these people. They definitely have an increased risk of having an attack during vigorous exercise. So definitely ways that they can control that is the breathing technique. So pursed lip breathing, diaphragmatic breathing are good. If you look on page 148 in your textbook, it talks about both of those. But also, I do have a video on breathing techniques that I want you to watch as well. So if you want to pause the video, watch that or pause this video and watch the one on breathing techniques. It's a great example of some of these diaphragmatic and different types of breathing we can use. But as far as asthma in general, a group fitness instructor should follow some basic general exercise guidelines. So if we have a person who has pulmonary exacerbations, right, before exercise or during exercise, they start to have pulmonary issues going on, physical activity should be limited until these symptoms subside. We don't want to continue doing what we're doing if they start to experience any pulmonary distress. Also encourage these people to utilize an extended warm-up or an extended cool-down. So instead of taking maybe 3 minutes to do a warm-up, maybe we're taking like 8 to even 10 minutes to do a warm-up for these particular individuals. Emphasize hydration. Drink water lots before, during, and after exercise to keep the airways moist. Okay, use the diaphragmatic breathing or the pursed lip breathing to help them. use the RPE, ratings of perceived exertion, and also limit their exposure to cold air, polluted air, or high allergen environments, because each of those can trigger an asthmatic response. Steps for managing an asthma attack. Basic things we can do is just have them rest and relax. If we have a person in our class that's going into an asthma attack, we want them to rest. We want them to stop. We want to make them feel comfortable. So if you can talk in a calm voice to them, that's the best thing you can do, because if you get worked up and you get excited, that's going to cause them to get excited, which is also going to in turn cause them to, suffer a greater attack. So you want to be calm, cool, and collected in order to make them feel comfortable. Okay, if they have medicine, have them take it. Most people who have asthma have an inhaler, and normally they bring it with them to class. I always, when I find out a person has asthma in one of my classes, I always ask them, did you bring your medicine today? Before we even start class. So I know, yep, they've got it, it's in their bag. So we can grab their medicine, their inhaler, and have them take that as soon as possible. And I always encourage them to, hey, maybe take a puff off your inhaler before coming to class. That way your airways are open, your bronchial tubes are open, and you're ready to exercise. Drink warm liquid. Have them drink slowly, but we do not want them to ingest anything cold, nothing cold. Okay? If you have any doubts, obviously we can call 911. If their lips or fingernails are turning blue, obviously if they're, not coming out of that attack, that's definitely when we want to call 911. But it is something that many people have. I've had many people in my classes who have asthma, but again, I'm just constantly, making sure that they understand you have to bring your inhaler, maybe take it before class if need be, but as long as they have their medicine with them, and then they also monitor their intensity, and if they feel an attack coming on, they need to rest, right? They need to relax and let them know that that's okay that they do so. So think it through. When you're teaching a yoga class, what specific breathing techniques could you incorporate that would be beneficial for participants with asthma? Pause the video, take a minute, try to come up with your answer now. Okay, so you should have paused the video. Now we're back. The best type of breathing technique would be diaphragmatic breathing. This is best for people with asthma in a yoga class, especially at the beginning of class. Encouraging your participants to check in with how they're feeling and focus on slow, deep breathing helps them stay engaged with their breath. Reminding them to breathe deeply at different points throughout the class can also benefit participants with asthma as well. The next population are those with arthritis. So osteoarthritis is pretty common. That accounts for about 85% of all arthritic cases. Okay, so people who have arthritis, there's rheumatoid arthritis and osteoarthritis. So osteoarthritis is the more popular type of arthritis. So what it is, it's that degeneration of the synovial fluid that surrounds the joint. It's kind of that protective fluid that surrounds our joints, but we're tending to lose that. So we're having more of a bone-on-bone type of situation, which can be very painful. So it usually affects the weight-bearing joints of the lower extremity. So the knees, the hips, the ankle, and even the wrist are the more common areas that are affected. So some of the common symptoms that people see with osteoarthritis is that localized joint pain. It hurts in that particular joint. It's in one area. They're stiff, especially in that joint. They don't have a great range of motion throughout that joint. And then also sometimes they see atrophy or shrinking of the muscles that surround those joints. So some general exercise guidelines to keep in mind with these particular participants is to avoid vigorous exercise, especially during acute flare-ups. Okay, if they have times of inflammation, we do not want them to do vigorous exercise. Instead, gentle range of motion exercises are recommended. Also, we could explain that a small amount of joint pain or even muscle discomfort is normal. Okay, it comes with the territory, but it does not necessarily mean that damage has occurred to the joints. However, reducing our volume and intensity if pain is present at higher levels 2 hours after the exercise session than before the session. So we want to definitely, if we have a person come back and say, wow, my pain in my joint was really bad for, the whole next day after my exercise session with you, then they need to definitely reduce the volume and the intensity of what they're doing. Warm-ups, sometimes extended warm-ups, 5 to 10 minutes, are important to ensure joint lubrication and increased elasticity of those tissues that surround the joint. Do light aerobic exercise. That's going to increase that systemic blood flow to the body. Dynamic flexibility exercises are key. Perform adequate cool downs. Again, 5 to 10 minutes, taking those joints through a full range of motion. If you're doing anything in the water, temperatures of the water should be 83 to 88 degrees. That's where people with osteoarthritis tend to excel. They do well in the water. Their joints feel good, but the temperature has to be right, 83 to 88. That's going to help relax their muscles and reduce the pain. Start with bilateral exercises and advance to unilateral. So do both sides, but then you can do one side at a time. And perform activation exercises to target specific areas, like for example the knees or the hips, during the warm-up and the body of the class. So again, many people suffer arthritis and they can participate safely in our classes. Another, think it through. What modes of group exercise are most beneficial for people with arthritis? Pause the video, come up with an answer. Okay, you should have your answer. The best type of exercise is low impact. Low impact. Okay, so again, water fitness, water aerobics, in warm water though, right? 83 to 88 degrees Fahrenheit. Yoga is another great mode. Moderate strength training, cycling, low impact cardio are all perfect for people who have arthritis. Another common population is diabetes. That's a chronic disease that many people suffer today. Diabetes in general is characterized by the abnormal utilization of carbohydrate by the body, which results in elevated glucose levels, so elevated blood sugar levels. There are different types of diabetes. You have type 1 versus type 2. Type 1 generally is called juvenile onset diabetes because we tend to see the development of the disease at a younger age. But with that said, people older also develop type 1 diabetes at an older age. So in type 1 diabetes, something happens to the beta cells that produce insulin. Insulin is produced in your pancreas. So something happens where there's a viral infection early on in life, maybe that attacks the beta cells, and now the pancreas is no longer able to produce insulin. And insulin is actually the key that unlocks the gate. It allows glucose to flow out of our bloodstream into our cells so it can then be used to produce ATP, adenosine triphosphate, which is the energy molecule. So people who have type 1 diabetes, their body doesn't produce insulin, so they're dependent on it. They have to take injections of insulin when they eat every single day, okay, for them to survive. So type 1 is considered an autoimmune disease, okay, the destruction of those pancreatic cells that produce insulin. Type 2 diabetes, on the other hand, used to be called adult onset. People normally years ago didn't develop type 2 diabetes until maybe they were 40 years of age or older. But today, adolescents are developing type 2 diabetes more than ever. One of the most commonly or frequently cited risk factors of type 2 diabetes is a sedentary lifestyle. And kids today, what do? They sit, right? They watch TV, they play video games. They're not as active as they were in the past. What's happening with type 2 diabetes is the pancreas does still produce insulin, but the body becomes resistant to the insulin that's being produced. So now the pancreas has to work overtime to produce more insulin to unlock that gate, to allow that glucose to flow into the cells. And over time, if that continues, the pancreas will eventually stop producing insulin. So type 2 diabetes is a disease that people can eliminate by making healthy lifestyle changes. As far as exercise considerations for people who have diabetes in general, they should test their glucose levels prior to exercise. If it is below 100 milligrams per deciliter, they should consume a small carbohydrate snack before exercising. They need to adhere to an eating schedule that includes a balance of protein, fat, and low glycemic index carbohydrates to maintain the normal glucose levels in their bloodstream. So if you've had the nutrition class, you will have learned all about that. They need to hydrate before, during, and after exercise. They need to avoid high-intensity exercise when their blood glucose levels trend low. So if they have lower blood sugar levels, they need to avoid high intensity and also maintain proper foot care. Okay, sometimes long-term consequences of folks with diabetes is neuropathy. Okay, they cannot feel, right? The nerves leading to their feet, for example, they can't feel anything. So if they get a sore or an injury on the bottom of their foot and they don't take care of it, that can lead to some pretty serious consequences. So as far as hypoglycemia, that means low blood sugar levels. Some signs of low blood sugar levels would be just anxious, uneasy, irritable, very hungry. They're confused, they have headaches. That's a quick, easy sign that, hey, maybe they have low blood sugar. And so simply making sure they're ingesting something with sugar in it. Maybe it's a regular soda, maybe it's fruit juice. It has to have sugar in it, and it should be readily absorbed into the bloodstream. So it's, as a group fitness instructor, for example, I always keep little packages of fruit snacks in my bag. So if I do have a person experience hypoglycemia or low blood sugar, they can simply ingest that quickly, and that will raise their blood sugar levels rather quickly. Late symptoms of hypoglycemia, you can see long-term consequences of constantly having this lower blood sugar are a little more detrimental. So double vision, right? It starts to impact a person's eyesight. It starts to impact their kidneys. It starts to impact their nerves. It can lead to heart disease over time. So lots of negative things that come with the long-term result of diabetes. So if a person's having an insulin reaction or low blood sugar, stop doing what they're doing. Have them sit down, check their blood sugar levels if they have the ability to do so. Drink orange juice or something that's rapidly absorbed. Okay, it's got to have sugar in it. Sit quietly and wait for the response. When they feel better, check their sugar again. If it's above 100, they can resume activity. Okay, check it after 15 to 30 minutes to assure that the levels are within a safe range. Don't allow them to leave your facility until their blood sugar levels are within a normal range. If they do not improve, definitely seek medical attention. So these folks with diabetes, definitely checking their blood sugar regularly is important for them. Another common symptom that people suffer is lower back pain. This is a non-specific symptom. There are many things that cause back pain. One of the biggest ones is probably mechanical problems. So we don't pick things up properly. We don't carry things properly, right? Our body mechanics and the way we carry our body simply leads to chronic pain in our lower back. Having excessive body weight, people who are overweight tend to suffer back pain more often. Some injuries can lead to back pain as well, and then also certain chronic diseases can also. So, exercise is definitely a key preventative measure for people with low back. So it can not only prevent, but it can also help treat that lower back pain. So some considerations to think about if we have a participant with back pain. If they have a history of back pain, they definitely should consult with their physician and get specific recommendations for exercise. So before starting a program with us, that's something they should definitely talk to their healthcare provider about, especially if they have not been active in the past. Extended warm-ups and cool-downs are really important for this population. Always be aware of proper form. Form is key, so have them exercise in front of a mirror. Make sure that they're paying attention to that form. They do not want to work through the pain. That saying no pain, no gain is definitely not a good thing for this population. They do not want to be in pain. Always try to maintain neutral posture, an erect torso during any of our movements. So cueing that spine, making sure they're sitting up tall, standing up tall with that neutral posture. Avoid forward head positions in which the chin is tilted up. Okay, so again, going back to that neutral alignment with your spine. When you're leaning forward to lift or lower an object, always hinge at the hips and bend the knees. Avoid hyperextending the spine in an unsupported position. Also avoid extreme range of motion. Avoid excessive spinal flexion under load. And avoid abrupt twisting movements for people who have low back pain. This is a common area that we're going to see in many of our classes. So definitely want to focus on strengthening the core. So things that are going to strengthen the abdominals and the lower back are going to help those individuals with low back pain. But also gentle range of motion flexibility exercises are important for this population too. And a couple special populations we're going to talk about are older adults first and youth. So as far as older adults go, many people can exercise to a ripe old age. So definitely if we're doing exercises for this particular special population, we want to really focus on functional capacity. We want to do exercises that are going to help them to perform their activities of daily living. What do they do at home every day that I can incorporate exercises into my class to better prepare them to do those exercises at home. We want to focus on mobility, right? We want them just to be mobile, to be able to move. Balance is huge. Older adults have a high risk or a high fall risk. So definitely working on balance is really important for this group too, so they don't fall, because when older adults fall, we see more fractures and more bone breaks because their bone mineral content is normally lower. We also want to focus on strength, power, and of course that bone health. So as far as instructing this population, we want to ask participants at the beginning of class if they have any limitations that they should share with us. We want to know for this population, is there any special limitation we need to know so we can modify for them? Extended warm-ups and cool-downs are so important with this population as well. Incorporate exercises and movement patterns that they can replicate on their own at home. So do things in class that they know that they can replicate and do at home on their own. Be mindful of older adults' ability to move quickly from the floor to seated or even up to standing positions. They take a little bit longer, so we want to make sure that we allow that time for them to move and transition into different positions. Monitor their intensity using the dyspnea scale or the RPE scale. Select music that's appealing for them. Ask them, what do you enjoy? What type of music do you enjoy? And put together playlists that they like. Also be mindful of the music and the microphone volume. Okay, you don't want to have it too loud or on the flip side too soft where they can't hear it. And also be aware of your tempo. We don't want it to be too fast. It's got to be a slower tempo so they can keep up. Anything outdoors, allow them to complete shorter distances or offer stationary options where they can do it standing in one place. If you're doing agility, dedicate a specific lane in the area for the less complex coordination and agility exercises. So a specific area for those exercises that are less complex and maybe the agility stuff. If you're using tubes or bands, coach them to control the eccentric phase, the lengthening phase. And lastly, include cognitive exercises. So for example, having a tennis ball and tossing it to them and asking them to catch it with one hand. So you're involving the mind and the muscle together. So cognitive exercises are also great for this population. And then the next population is the youth. So as far as youth goes, considerations to think about: exercising in the heat. Youth, their cooling mechanisms are not fully developed, and it takes them a little longer to cool, so they're going to need more frequent breaks, water breaks, during exercise than an adult would. We have to be aware of their muscular development. We want to gamify it. We want to make it fun. Okay, so some of the classes we teach for adults are definitely not going to be fun for youth. We want to make it fun for them. So games are always a great way to do so. But we want to also encourage safe use of any exercise equipment that we do use. So teaching these youth in general exercise guidelines, we want to take caution when exercising in hot, humid environments, because heat exhaustion can occur quickly if a child's core temperature rises faster than his or her dissipation rate. So again, be cautious of those hot environments. For children, max heart rate is much higher than in the adult population. It's usually between 200 and 205 beats per minute. Blood pressure responses during exercise are similar among youth and adults, although systolic blood pressure changes during exercise tend to be lower in children. There's a lower systolic change. The RPE may be a way to measure exercise intensity for youth over 8 years of age, but younger children may not have the cognitive skills to use the RPE scale accurately and consistently. So easy and hard may be the extent of their communication. Before the onset of puberty, muscle strength can be improved similarly in both males and females through resistance training, whereas during puberty, maturation and testosterone levels increase muscle size and strength more significantly among males. Also, gamify your exercise sessions and encourage them to use their imaginations when exercising. Supervise appropriately and use lightweight equipment for safety, and encourage safe strength training practices to instill good habits for the future. So working with kids can be so much fun, but we also have to think about it in a different light, and using more games and obstacle courses and relay races and things like that just to make it fun, but also teaching them the importance of exercise. And the last special population is the prenatal and the postpartum population. I do have a video that I'd like you to watch that deals specifically with this particular population, and that's going to answer all your questions. Okay, so if you would just pause the video, go ahead and watch the video, pause this video and watch the video on prenatal and postpartum populations. Then you're going to come back and you're going to answer this question. When teaching a group strength class that includes several participants who are pregnant, what alternative exercise options could you suggest in lieu of a supine abdominal strengthening exercise like a bicycle crunch? So go ahead and pause the video. Take the time, watch the prenatal and postnatal exercise consideration video now. Okay, we're back. Hopefully you learned a lot from that video. But as far as answering this particular question here, after the first trimester, which is that first 3 months of pregnancy, supine and prone exercises need to be avoided. So anything where they're laying straight on their back, okay, supine, or on their belly, prone. We do not want that to occur after that first trimester. Instead, we can replace the supine positions when they lay on their back with a semi-recumbent and side lying position. So when they kind of lift one side up off the ground so they're not completely flat, they could do a semi-recumbent crunch, for example, instead of laying flat on their back. They could also replace anything prone where they're laying on their belly with an all-four position, so hands and knees, or they could do elbows and knees. Okay, so those are some simple things we could do. They could still do abdominal strengthening exercises, but we can't do it laying flat on our back. We can lay kind of partially, but not completely flat on our back. And then lastly, common medications. Some of these populations, especially those folks who are cardiovascular or have high blood pressure, they might be taking different medications. And just understanding that some of these medications can have an impact on heart rates. So the biggest one that we see listed at the top is the beta blocker. So a lot of cardiac exercise participants, people who have heart disease, they might be on a beta blocker. And a beta blocker across the board is going to reduce heart rate. It's going to reduce resting heart rate. It's going to reduce exercise heart rate. It's going to reduce max heart rate. So if that's the case, heart rate is not going to be a good indicator of their intensity during exercise. So instead, we want to use the RPE scale for this particular population. So if we know that that person is on a beta blocker, we can't depend on their heart rate to tell us the appropriate intensity of that person. So this chart is just going to tell you different types of medications and things that people take. And if it does impact heart rate, decrease it, increase it, or no change, you'll see that listed on that table here.